Is Mental Health Awareness Month. Joining us now live for an in-depth discussion on mental health is Cathryn Nacario. She is the CEO for the San Diego National Alliance on Mental Illness. Thank you so much for joining us, Cathryn.
Thank you very much for having me to talk about this very important subject.
So we were just talking about Naomi Judd and how her death is putting a bigger spotlight on the issue of mental health. What would you say are some of the most important things for people to know about mental health?
I think what we need to know about anybody who's experiencing a mental health concern is that it happens to all of us. At some period in our life, many of us experience some of the highs and lows, or maybe some more serious mental illness types of symptoms. But what's very much really important is as soon as you start feeling that something might not be right, is to go ahead and seek help. Talk to your family members, talk to your primary care provider, go to your faith leaders in your community. 1 in 5 of us experience a mental health concern of a significant nature each year. So it's something that is common for all of us and happens in all of our families and in our communities.
Are you seeing an increase in people struggling with mental health issues right now?
We are, especially as we're coming out of the 2 years of being in the pandemic, a lot of economic instability that's happening now. We're seeing an increase in calls even locally into our resource line, into our warm line on a national level as well. They're seeing higher levels of phone calls in for people just needing to talk, not sure where to turn, if what they're feeling is normal. So we really do need to normalize the conversation surrounding mental health. Just like many other diseases, this is a brain disorder that you can't see, just like you can't see cancer or high blood pressure, but it's there and it's very, very real. And what's really unique about mental health disorders is that it's very individualized. It can reflect differently for each person who may be experiencing a similar diagnosis. So that's sometimes what makes it so difficult to treat as well. So getting started early, getting the support of your loved ones, friends, caregivers, is so vitally important.
Cathryn, what would you say are some of the biggest warning signs for people to look for, not only in themselves, but in those that might be close to them or around them?
Sure. Some of the early warning signs are a loss of interest in something that the person loves. Say they love to go play baseball, and all of a sudden they're like, no, I really don't want to do that today. Spending more time alone, maybe losing the ability to sleep at night in particular, having insomnia, or on the other spectrum, sleeping too much as well. Also, all of a sudden the person's just withdrawing into themselves and you're having a hard time having the conversation. And many times it's just okay to be, I love you, I'm here for you, and I'm ready for whenever you are. And saying that on a very consistent basis when the person for a period of time may be not willing to share or not willing to talk, but knowing there's that presence always gives hope as well. So really changes in behaviors, changes in patterns that may be very concerning for a family member or a person yourself. All of a sudden, you know what, I'm not feeling so great today, but this is lasting more than a day or two. It's lasting for quite a period of time.
And it also sounds like you were just describing there's a lot of resources out there. It's just about recognizing that you might need help or someone near you might need help and trying to reach out for that help.
Correct. There's plenty of resources. We have a lot of local resources here in San Diego County. If you're needing somebody to talk to and don't know where to turn for clinical support or looking for a counselor, please call our local access and crisis line, which is 888-724-7240. That means 724. So they are open 7 days a week, 24 hours a day, and you'll be able to talk with the clinician immediately, as well as get plugged into resources in our community as well. Then, of course, there's a national suicide prevention hotline, also a great band of experts that can help you at a moment's notice. There's now text lines. There's a whole variety of modalities where people can access information in a way that they feel most comfortable, which is a really, one of the great things that came out of the pandemic in particular is a broader use of telehealth services.
All right. Cathryn Nacario, CEO for the San Diego National Alliance on Mental Illness. Thank you so much for your time today.
Thank you.
And again, if you or anyone you know needs help or someone to talk to, you can call the number on your screen, 888-724-7240.